and welcome to another episode of Bite-Sized Medical Education from Spear Medical. I'm Eric. Today we're going to be looking at the causes of traumatic chest injuries. So we're going to introduce you to a handy mnemonic that will allow you to start predicting some of the potential injuries your patient may have incurred as a result of exposure to a trauma. So we're going to introduce you to the mnemonic BLATM FC. So that's BL ATOM FC. So BLATM FC. We're going to fill in the blanks for you, but what this is going to do is hopefully just give you some idea of the things that could be sort of going on with a patient's chest with with your patient's chest. So we'll start off with BL at the top. So that is straightforward blast lung. So blast lung is that sudden change in pressure causing barotrauma to the really sort of fine terminal ends of a patient's airway. So if these were your lungs, the tiny little blood vessels that surround each of your alveoli are exposed to a sudden and violent change in air pressure, causing them to rupture and widespread bleeding to occur in these terminal airways. So that's blast lung. With A, we talk about airway compromise. So this could be anything really. So we're talking airway burns, upper trauma to the neck, causing swelling to occur around the soft tissues of the throat, or actual sort of foreign bodies. It sort of maxes so that general facial trauma, that sort of dental damage and sort of trauma of the sort of soft parts of the upper airway causing swelling, regardless of its cause. We're talking about airway compromise of some kind with a traumatic reason for it to occur. We've then got T, which brings us on to tension pneumothorax. So tension pneumothorax obviously is air trapped in the pleuritic space, so that space between the lung and the sort of sac that surrounds the lung, if you like. We've then, moving on from tension pneumothorax, got open pneumothorax. Oop, forgot my U there. So open pneumothorax. This is what we were talking, a hole in the outside of the chest that's gone through to the inside of the chest. There's involvement with that sac that the lungs are in again, and actually that hole is communicating air from the outside, the external sort of environment to the inside of the chest. So if this is your chest here, we've got a hole in the chest, and air is preferentially moving. It's sort of going through the path of least resistance and preferentially moving in through this tiny hole in the chest, rather than in the mouth and down through the trachea, the mouth and nose, and down through the trachea as it normally would. So air's preferentially moving through this shorter distance through this communicating hole in the chest, and that's your open pneumothorax. We've then got M, which stands for massive hemothorax. So if pneumothorax is air trapped in the lung, we are talking about massive hemothorax now, which is blood filling the chest cavity and causing an impedance of the normal expansion of the chest and the lungs' ability to sort of expand and utilize the air that's going into it. We've then got FC, which stands for straightforward flailed chest. So this is that classic. You've got your ribs, so the bone's in your ribs, and all of a sudden, for whatever reason, there is some damage on both sides of a portion of those ribs. So actually what you get is, if this is your normal sort of rib with a sort of normal continuous bone, you've then got a normal broken rib where there's a single fracture along the length of the rib bone somewhere, and then this would be your flailed chest segment where actually you've got the length of the rib, there's a break, a segment of unbroken rib, and then a further break. So this could be in a single rib or it could be in multiple ribs, But what will happen is you'll get this paradoxical chest movement where as this portion of the rib expands, and this portion of the rib expands because it's attached to the chest as normal, because you've got this free floating segment here, sort of doing whatever it wants, you actually end up with some paradoxical chest movement. So whilst these two sort of portions of ribs are sort of expanding or sort of relaxing as normal with breath, what will happen is this section will move independently and in the opposite direction. So as the your ribs on inspiration sort of lift upwards and outwards, what you'll actually get is a drawing in of this flailed chest segment, and then the reverse when you exhale. So as your chest comes back to rest, this portion of the chest, this flailed chest segment will move outwards, and it's quite easily spotted when you do see it. It's quite obvious that there's something abnormal going on there. So that's Blattom FC. So we've got blast lung, airway compromise, tension pneumothorax, open pneumothorax, massive hemothorax, and flailed chest. So it's a nice, easy mnemonic, easy to learn, easy to remember, that'll just give you some idea of the type of injuries you could expect in your patient following exposure to trauma. I hope you found this helpful. If you did, please give the video a like and subscribe to our channel, and we look forward to producing more content for you. Thank you very much.